Okay, hello, everybody. Um, Welcome to Actual Edge. Hi, el duende satírico. Welcome here. Thank you for your support today, and thank you for joining in Actual Edge for the first time live streaming to answer some questions about HIV and AIDS. This topic that we've been covering in the channel for a long time. And we're very excited to cover today. Welcome, everybody. I see a lot of you are logging in right now. Please feel free to put your questions in the chat box. I'm going to start speaking a little bit about a trial that didn't go really well at the beginning of this year, but that we're feeling quite optimistic about. This was Mosaico company that was developing a vaccine for HIV, but eventually it was discontinued by Janssen. But we've learned a lot about the future of HIV research thanks to this failure. You all know that in Actual Edge we try to be very optimistic about new developments related to HIV. Some of you ask a lot of questions. When will we get the vaccine? Today, if you have that question, please post it in the chat box and we will try our very best to give an answer. Try to provide as many reasons as possible, like are you infected with HIV? What's your location? What worries do you have about this horrendous virus that has taken the life of millions and millions of people, but that every year that goes by, we manage to find new ways of preventing and new ways of dealing with the virus itself with ART medicine. More and more countries are getting access to this medicine. We are aware that in some countries, public hospitals or social security will give you this medicine for free. We are also aware that other countries don't give it for free and make it a lot better. Hello, Isis Sifo. Welcome here. You always give us a lot of support in the channel. If you want, please put your comments in English or in Spanish so we can solve them. And if not, my partner could translate this comment into English. So, El Duende Satírico, if you could please translate from Azari to English. I think that's the language you're speaking, I say, but I'm not certain. I've seen your comments before, and I thought that it was Azari, the language from Azerbaijan, that you always give us the comment. Please announce a definite cure. All right. So, Mr. Isis Sifaloglu, we don't have a specific date in which the cure will be released. But what we do know is that the WHO, the World Health Organization, has already promised to have a cure available by 2030. Now, we think that the WHO are only trying to cover their backs and announcing a further date than the one where it will be released. What does this mean? According to the research we do on a daily basis and the people we are in touch with at Actual Edge, we are more optimistic and we believe that the cure might be available 2025, 2026. At least this would be in the United States. Then once the Once the company's, we can call it copyright to make it understandable for our audience, expires after 2 years, countries like Azerbaijan will be able to get it under a different name. So we can understand the deep concern for a definitive cure. Living with HIV conditions is very challenging, especially if you don't have access to any type of medicine to cure it. And we are just want to clarify that ongoing research is being conducted to advance treatment options. While a complete cure might not be available yet, medical advancements have significantly improved the quality of life of many individuals. A lot of people come to us, send us emails, put comments on our videos saying that right now they are at their very best. So it's essential to work closely with healthcare professionals to explore the most effective treatment plans. Remember, I say you're not alone, and you will always find a place to get support from us here at Actual Edge. So, while I wait for your questions, I'm just going to continue speaking a little bit about this trial that failed. Again, I'll put you into context. This is the phase 3 Mosaicos trial that was discontinued by Janssen. And reflecting on this trial, it's essential to see it not merely as a failure, but as a valuable learning experience. Insights from the antibody mediated prevention, we can also call it AMP, are particularly noteworthy, revealing that high antibody levels can prevent HIV acquisition. It seems like the higher the level of antibodies, the less likely you will get HIV. Now, this critical discovery now steers our focus towards creating vaccines that effectively trigger non-neutralizing antibodies. We no longer want to destroy them. We want to be more present than ever, so the virus can destroy itself. I know it sounds a little bit confusing, but you have many videos in our channel explaining these facts. Anyway, the challenges posed by the genetically diverse HIV virus are immense. Very different to other viruses, HIV keeps changing its genetics, changing its composition, making medicine quite slow, or making medical advancements quite slow, or taking one step forward and 2 steps back. But this critical discovery now steers our focus towards creating vaccines that would promote antibodies instead of trying to fighting against them. Now, considering the timeline for a HIV vaccine, personally, here at Actual Edge, we anticipate a crucial phase of success within the next 5 years, followed by extensive clinical trials spanning at least 4 years. While we might not personally witness the culmination, the ending, the conclusion of these efforts, we find fulfillment in contributing to their overarching quest for a HIV vaccine. Now, in the realm of mRNA vaccine research, we emphasize its versatility and urge for increased focus and resources dedicated to its utilization in HIV vaccine development. Now, it's very important to establish an RNA manufacturing capabilities specific to HIV, mirroring the successes seen in mRNA technology during the COVID-19 vaccine development. It's absolutely crucial. Okay, sir. While it's going to be difficult for us to translate to Turkish, I think that my partner will manage to put this translation in the chat box. So watch out to what El Duende Satírico has to say, and he will give you a translation of what we believe will be the end of HIV. So, Duende Satirico, please let him know about 2030 being the date given by the WHO, but also remind him that thanks to many advancements recently proving that the importance of antibodies to defeat the virus, will make us believe that in a period of from 3 to 5 years, we will find a vaccine, Mr. Ice. And again, I see there's 16 people in the stream. Welcome, everybody. We're here discussing a few advancements made in the vaccine for this horrendous virus. If you have any questions regarding a cure, regarding your situation, please let us know, and we would be more than happy to help you out and to solve these questions, of course, if we can. Anyway, I wanted to continue speaking about these advancements because last thing we mentioned is that with COVID-19 is one of the first times where the whole world have decided to get together to find a cure for such a horrible disease. The problem with HIV is that it doesn't affect as many people as COVID did. What does that mean? That the medicine field will make advancements in a lot slower way. HIV affects a lot of people worldwide, but we need to take into consideration that the countries where people are affected the most are countries that either developing or not doing very well economically. So the whole world and the medicine industry will not work as fast as they did with COVID-19. However, drawing some parallels between HIV and COVID-19 vaccine development, it's evident that the successes in COVID-19 has significantly impacted advancements in HIV research methodologies, particularly highlighting the essential role of mRNA technology. These discussions echo a feeling of unwavering determination and optimism within the scientific community. They underscore persistent efforts in advancements poised to transform the landscape of HIV prevention. That's the reason a lot of people in the comments always tell us that we are giving fake news, that the information we are sharing with you is not true. Never at Actual Edge we will confirm that the things we are saying are 100% certain. Recently, we published a video about an Indian doctor that claims that Himalayan plants might be the cure for cancer and HIV. We are not saying this is actually true. We are not saying that this is what's actually going to happen. We're just giving you the information, and we also give you the science behind the claims of many doctors, of many biologists, or many other people around the world. Speaking about biologists, today I want to expand a little bit on different perspectives that might not be as optimistic as ours. Hello, Mr. Santosh Angadi. Welcome to our live stream. When will HIV come? That is a very good question that we get very frequently in our comments of every video. Now, we cannot provide you a specific day when the HIV vaccine will come. We can just repeat what the WHO has confirmed already. They already said that the vaccine will be available by 2030. Now, at Actual Edge, we've done a lot of research. We've talked to a lot of doctors, to many hospitals, to many PhD biologists, and they all have one thing in common. They all believe that we will be able to find a vaccine before the WHO claims it. What does this mean? This means that in 3 to 4 years, after many clinical trials, after a lot of developments, we are very likely to have a vaccine in the United States of America. Santosh, I am not Indian. No, I am not from India. But we are very aware that in India we're having a very big problem about this. And El Duende Satírico, thank you for answering. Remember, there's other people in the chat box that want to ask questions. So, Mr. Santosh, just to clarify, I wanted to tell you WHO will have a vaccine ready by 2030. And we believe that this will be a lot before, okay? So please stay tuned and don't lose faith in something that I know at times is very hard, and especially when we are trying to find an answer on a daily basis, especially when we are suffering under this horrendous virus, Mr. Santosh. So I hope that answers your question. So, and we have another question here by Nataraj. In viral load report is saying RNA is not found. What is the meaning of this? Okay, so a viral load report states that RNA is not found generally means that the test did not detect the presence of viral RNA in the sample. In the context of HIV, this result is typically a positive outcome, indicating that the viral load is undetectable or very low. Having an undetectable viral load is a positive sign for individuals with HIV who are on antiretroviral therapy. I'm not sure if this is your case, Mr. Nataraj. It suggests that the medication is effectively suppressing the replication of the virus in the body. An undetectable viral load doesn't mean that the virus is completely gone, but it does mean that the amount of virus in the blood is so low that it cannot be detected by the specific test being used. Now, it's very important to note that an undetectable viral load does not cure HIV, but is associated with improved health outcomes and significantly reduced risk of transmitting the virus to others. It's always recommended, sir, Mr. Nataraj, to discuss specific test results with a healthcare professional. Now, overall health and treatment plan is also essential. So, sir, wherever you are, go to your local hospital so you can confirm the data that is being shared from us. Okay. Thank you very much, Mr. Santosh, and thank you very much, Mr. Nataraj, for your questions. And Mr. Aise, I'm hoping that my partner is able to provide a good translation to the issues that you're facing. And we're hoping for the very best, not only for you in particular, but the entire country of Turkey, where I know HIV has been increasing by 3 times since 2012. This is a common problem, not only in Turkey, but worldwide. Earlier, I wanted to comment a few important things about misconceptions we have regarding HIV. So we could say that there's a lot of myths regarding HIV, right? For example, a very common myth is that HIV can spread through casual contact. There's many people that have stigma towards people that have this virus. And the truth is, this is a factual truth, we're not going to lie about this, HIV cannot be transmitted through casual contact like hugging, like kissing, or by sharing any form of utensil. If we use a spoon, if we use a fork from someone who's been infected with HIV, even if that person got blood on it, the risk of you contracting HIV will still be lower than 0.01%. Saliva plays a very important role in HIV. It almost neutralizes it. So even if one person that has HIV kisses another person that has HIV, and both of them have sores in their mouth, both of them have open wounds, the contact would still be the contact risk, would still be extremely low. So please don't become paranoid about HIV. Please stay positive. And believe me, a HIV cure will be ready very soon. And as we were saying, don't be discouraged by myths that of people that don't know about about HIV. Always be informed by reliable sources of information, like Actual Edge, from reliable newspapers, like AIDS Map, which is a fantastic place where we can find more information about, and never trust what everyday people say. Okay, Joseph Gelesikamatze, I'm sorry if I'm not pronouncing your name correctly. You're asking us a question here. Hi, doctor, can you come up with something or try to get a vaccine which can prevent HIV transmissions from one person to another? Now, just to clarify, there isn't a vaccine available that prevents HIV transmissions between individuals. However, every day we make new progress, Joseph. Preventing the transmission of HIV remains a global priority, and there's a lot of strategies being explored on a daily basis, including the development of vaccines. Scientists are working on creating a HIV vaccine that can stimulate the immune system to recognize and fight the virus effectively. Now, Mr. Joseph, I'm not sure where you're from, but you can always access PrEP medicine that would give you a very low risk of you transmitting HIV when having sexual relationships with other people. So from both sides, please rely on PrEP medicine. If you want, Mr. Joseph, confirm what country you're writing us from, and we will be able to give you some support on where we can find, or what places in your city or country would you be able to find this PrEP medicine. And of course, I know that the biggest problem with this medicine is usually the cost, which is extremely high. So, Mr. Joseph, I hope that answers your question. Just a quick reminder, it's important to note that the development of vaccines is a complex process. It doesn't happen from one day to another. The only case where vaccines were able to be produced so quick was in the case of COVID-19, because not only did it affect a selected group of people, it affected the entire world. So it was a world priority to find a vaccine that would stop getting people from dying from COVID-19, from coronavirus. Okay, when may confunction cure? Hello, Prandan. Thank you very much for your question. I know that it's a little bit difficult to respond when may a cure come, but as we've been saying for the entire time, the WHO has already confirmed that before 2030, they will have a cure for HIV. And we can confirm from Actual Edge that we've done a lot of research, and that a lot of doctors and PhD biologists and people doing research in the field have confirmed that the WHO will always give us a later date to cover their backs. We would say that we will have an available cure in the United States from 3 to 5 or 6 years. But it's still to be confirmed, Mr. Prandan. However, thank you very much for your question. And now, Joseph, just remember that PrEP medicine, when taken consistently, has shown to be highly effective in preventing HIV transmission from one partner to another. So even with individuals with very high risk, let's say a very high risk type of case would be people sharing needles. Even under these extreme circumstances, PrEP medicine would still be very good. Now, before starting PrEP, it's very important, Mr. Joseph, to consult with your local doctor. But they can assess individual risk factors, conduct necessary tests, and provide guidance on what PrEP is a suitable option. Because let's say, Mr. Joseph, if you decide to take PrEP under your own conditions, buying them off the counter, you might have an underlying medical issue that you might be affected by. So, individuals that before you start PrEP or on PrEP typically undergo regular medical checkups, including HIV and STI, sexually transmitted diseases, infections, tests. This helps ensure early detection of any potential issues and promotes an overall good sexual health. Now, remember that combination prevention is also important. Um, while PrEP is a powerful tool, it's often recommended alongside other preventive measures, such as condom use. I know that for a lot of people, condom use is difficult because it doesn't provide the same feelings as you would get without using it. But from Actual Edge, we always want to insist that safety comes before pleasure. Condoms are the best possible way to avoid getting this horrendous disease. So we need to use them in order to find a solution. I know it's not an easy thing, but please be aware that using them will not only protect you, but also the partner you're sleeping with. I hope that answers your questions, Mr. Joseph. Mr. Prandan, 6 monthly injection available cure. Well, it's difficult to say because the medical field keeps changing all the time. You're asking me if it's available now, Mr. Prandan, but could you please tell me what country you're from so we are able to give you more information? You keep asking me questions, and I keep asking you to please tell us what country are you from. That way we will be able to give you the support you require. Mr. Prandan, if you don't give us the country you're from, the information we might give you might be confusing. Okay, so now we are going to continue speaking a little bit about the myths related to HIV. So another myth that we have is that people that have HIV tend to look pale or a lot sick than others. So we have to consider that nowadays people don't have to look bad physically in order to have HIV. What does this mean? Anyone in our surroundings can have HIV. So what we need to understand, what we need to be certain of, is that if we don't test, we will never be able to find out if we have HIV. In one of our videos, we were talking about Swaziland, Eswatini, a country in Africa, one of the countries that has the highest rate of HIV worldwide. Thanks to testing, they were able to find HIV in people and controlling this. Now, India is a very different country. What's the biggest difference between Eswatini and India? Population. India has 100,000 times more population than Eswatini. 1.2 billion people. It's going to be very difficult for India to test at the same level as Eswatini already did. So how can we ensure that everybody in India is protected? Well, unfortunately, the Indian government will not do much for its people. So it depends on each person to get tested, to find a way of discovering if you have HIV or not, and then taking the necessary measures in order to find out. Now, we need to, the 6 monthly injection, is it available now? Well, could you please specify what region from India you're from so we can provide more details about it, Mr. Prandan? That's why it's essential whenever you're asking a question to tell us where you're from and what city specifically, so we can do some research about that specific place and provide you an answer that will satisfy you. All right, so we I had CD4750 when I started ART. I am now 25 year. Can I expect years? Can I expect years with medication? I'm sorry, Mr. Prandan, but I'm not understanding your question. What do you mean by can I expect years with medication? Please try to be a little bit more specific. And if you're uncertain about the grammar you're using when asking the question, you can run it through ChatGPT so it can formulate the question in the correct way. My understanding is, can you expect years with medication? I'm pretty sure. Oh, life expectancy. Mr. Prandan, your life expectancy would be as high as someone who doesn't have HIV right now. If you're under the right dose of medicine recommended by your doctor, if you are covering all the essentials, HIV patients recently, in the last few years, don't have a much lower life expectancy than others. Now, the problem is that you will have to be taking antiretrovirals for a very long time in your life, Mr. Prandan. This means being very consistent. This means trying to always find a way of ensuring that you're taking your medicine on a daily basis, and ensuring that you test yourself regularly to ensure that you're doing fine. Now, one more piece of information, Mr. Prandan, that you might consider relevant is that the US Food and Drug Administration, the FDA, has approved a lot of new antiretrovirals on a yearly basis. But one of the newest ones, and I'm not sure if you have this one in India, is called Sunlenca, also by the name of, and let me write this in the chat box so you are able to find out more about the availability of it in India. Lenacapavir. For adults living with HIV-1 who have limited treatment options due to resistance, intolerance, or safety considerations. So this would be one of the safest retroviral medications that you could use, and is a capsid inhibitor. What does this mean? It represents a new class of antiretroviral drug that you would take on a dose as an oral tablet, and subcutaneous injection is done every 6 months. And the drug is intended for adult patients whose HIV infections cannot be successfully treated with other available treatments. So it's very good if we combine this with other antiretrovirals. It's proven to be very successful, just like the COVID vaccine was more successful if you combined different vaccines together. Now, just to clarify one thing, Mr. Prandan, the safety and efficacy of it showed an 85.5% success in the trial achieved in virus levels, showing a decrease compared to those on a placebo. So after 26 weeks, 81% of participants achieved HIV RNA suppression with lenacapavir. And after 52 weeks, 83% continued to have HIV RNA suppression. So, Mr. Prandan, I'm hoping that answered your question. Now, we have another question from Preran Gaming YouTube. Any cure medicine? As we already answered to Mr. Prandan, lenacapavir would be your safest bet. It's just been out in the market recently. I'm not sure if it will be available in India. I am not from this country. But if you could find this one, it would be fantastic. Guys, I continue to encourage you to put any questions you've got in the chat box. And if you could please state what country you're from for us to give you more information, we will be happy to do so. Here, we want to support as many people as possible. We understand how tough it is to have HIV, especially in countries where these medications aren't free. So from Actual Edge, we believe in optimism. We believe in the power of positive thinking. and we would like to give support to anyone who needs it. So please continue writing your questions in the chat box. While you do so, I'm going to continue speaking a little bit about different ideas, different stigmas of different myths that a lot of people believe. So the last one we talked about is that HIV people always look sick. The fact is that individuals living with HIV can lead healthy lives with proper treatment. HIV does not define a person, and many people may not show any symptoms for many years. Now, here's a fact. HIV is transmitted through specific bodily fluids. What could these bodily fluids be? Blood, semen, vaginal fluids, and breast milk. Unprotected sex, sharing needles, and from mother to child during breastfeeding are primary modes of transmission. Regarding HIV testing, a myth is that it's better not to know your HIV status. This is a misconception that in Actual Edge, we just want to tell you, please, if you have the slightest suspicion that you may have HIV, test yourself. Believe me, knowing that you have it nowadays with the technology and medicine we have means nothing. And the sooner you can get it, the less the possibilities of you undergoing any serious health issues. Early detection through regular testing enables prompt medical care and treatment, leading to better health outcomes. Knowing your status also prevents the spread of HIV to others. Now, lastly, I wanted to talk about living with HIV. With advancements in medicine that come on a daily basis, you know that we are constantly informing you about this at Actual Edge. Being informed, dispelling myths, and promoting accurate information helps create a supportive environment for absolutely everyone. Remember, guys, knowledge is power. Educate yourself, educate your community, encourage people to talk to doctors, encourage people to find reliable sources of information. Don't trust anyone in these HIV videos in the comments telling you that thanks to Dr. Osag, they found a cure to their virus. These people are scamming you. These people are selling you fake teas that claim that they cured HIV. There is no scientific evidence that any of these people are selling any type of herb that will cure your HIV. Please remain trustworthy in medicine. Remain as confident that science is what makes progress, not your local witch, not a crazy man on YouTube claiming that he has the cure to HIV. This will never, ever be the case. Drinking a tea to cure your HIV is as ridiculous as saying that you can get HIV from touching the same surface as another person did. So please, always trust the power of science. Always make sure that in your cases, you check with a doctor to see if you will be able to take any ART medicine. Okay, we have another question from Mr. Prandan. Okay, is ART medicine so side effect? Well, of course, like any other medicine you take, it will have some side effects. Now, we cannot say based on your genetics which one would you get most commonly, but we're going to give you a list of common ART side effects that a lot of people reported to their doctors. The first one, and probably one of the most common ones, is nausea and diarrhea. Some people may experience stomach issues, such as nausea and diarrhea. For these people, we recommend a diet that is low in fiber and low in fat. For example, heavy cream is something to be avoided. You can always use coconut cream instead if you tend to use this in your local cuisine. Now, fatigue has also been reported quite often. Feeling tired is a possible side effect, and it's essential to discuss persistent fatigue because this could be related with other medical issues. So please consider that, Mr. Prandan. Now, some people also develop headache and dizziness. It can occur especially at the very beginning of the treatment. It tends to wear off after 5 months, 5 6 months. Most cases would totally get rid of it, but even some of them in the first or second month will no longer have any headaches and dizziness. Providing skin rashes, it's something that is not as common as the other effect, but we've still seen some cases that skin reactions occurring. So please inform your healthcare provider if you see any skin changes. We know that also the dengue virus might give you very similar skin rashes to those you would get in ART. So always check with a doctor if you get any of these symptoms. Now, one side effect that is not common on other type of medicine but is in ART is changes in body fat distribution. Some medications can lead to changes in body fat distributions, such as fat loss from the face, arms, and legs. Liver issues happen a lot with people who take ART, and they also drink alcohol on a regular basis. Certain ART medications can affect the liver, so regular monitoring is typically recommended to assess liver function. Now, metabolic changes is also important, as ART can sometimes lead to metabolic changes, such as alteration in your cholesterol levels or blood sugar levels. So, Mr. Prandan, it's very important to go to the doctor regularly, especially make good use of your social security. Now, we have to continue going over the bone density changes, which is the last secondary side effect that I wanted to mention today, which is bone density changes, as some medications may impact bone density, which is a consideration for long-term use. But don't let this discourage you, as your local doctor can provide you a good alternative for this. Remember, Mr. Prandan, it's important to communicate openly with your healthcare provider about any side effects you experience. You can come over here to tell us, but we will not be able to treat you. So please go to your local doctor, sir. They can provide you guidance on managing side effects, and many adjust your treatment plan if necessary. In many cases, side effects improve over time as the body adjusts to the medication, so it's only a question of you getting used to it. Remember that the benefits of ART, which include suppressing the virus, preventing the progression of HIV, and improving overall health, often outweigh all these small side effects, so there's not much you should worry about, okay? Now, another question by Mr. Prandan. Actually, I have become new to tech 16 November 2023. I don't understand. What should I do? We can totally sympathize with you, Mr. Prandan. Now, if you've been diagnosed with HIV, it's important to following these steps. Listen to me, and if you have any questions about the things I'm telling you, let me know. Number one, as we've told you about 5 or 6 times today, consult a healthcare professional. Schedule an appointment with a healthcare provider who specializes in HIV treatment and discuss your recent diagnosis and share any symptoms or concerns you may have to give you peace of mind. Also, continue coming to Actual Edge so you can continue learning about HIV. Take the time to educate yourself about it, its transmission, and its available treatment options. Knowledge about HIV will empower you to make informed decisions about your health. Now, very important, starting an antiretroviral therapy, which I'm assuming you've already started. So this is a good thing. If your healthcare provider recommends it, start it as soon as possible. The sooner you start, the lower the chances of HIV having any impact on your actual body, as ART is essential for managing HIV and preventing the progression of the virus. And now, stick to your treatment. Don't be deciding, okay, I feel better now, so I'm going to stop taking it. No. Bad idea. Take your medication exactly as prescribed by your healthcare provider. Sticking to your treatment plan is crucial for controlling the virus and maintaining a healthy immune system. Now, we understand that you might feel a little bit distraught. You might feel stressed. You might feel depressed. So seek emotional support. We are always going to support all our viewers at Actual Edge. But a new HIV diagnosis can be emotionally challenging for everyone, Mr. Prandan. Consider seeking support from friends, family, or mental health professionals. Support groups or counseling can provide a safe space to discuss your feelings and concerns. We are pretty sure that most cities in the world have these groups. Don't be scared to talk about it. Don't be scared of judgment from other people, Mr. Prandan. Inform your partners. Now, this part is tricky. I know that you're probably very anxious, but you need to inform your sexual partners about your diagnosis so that they can also get tested and take appropriate measures. Now, from now on, please, sir, try to practice safe sex to prevent the transmission of the virus. And now, the last part we wanted to tell you is always follow up with your doctors on a monthly basis, so it gives you peace of mind. Attend regular follow-up appointments with your healthcare provider to monitor your health and adjust your treatment plan if needed. So, Mr. Prandan, this is what we advise you to do. And of course, if you need anything, we will continue to go live on Actual Edge on a weekly basis to answer some questions. So again, guys, we don't have much time left. So if you continue to have questions, please continue to paste them in the chat box, and we will do our best to give you the best possible answer. Now, I just wanted to finish our session today by speaking about stigma related to HIV. We've never covered this issue in the channel, and I think it's about time someone did. Stigma and discrimination against individuals living with HIV persist despite advancements in understanding the virus. People with HIV often face prejudice, judgment, and exclusion due to misconceptions about the virus and being uneducated. The stigma associated with HIV stems from fear, lack of awareness, and so it's attitudes towards people who have it, like, for example, homophobia, or to a certain extent racism, since Black people tend to have a higher chance of getting it. So we have a question in the chat box. Ben Abid Med, do you think, is there any hope for cure before 2030? This is an actually excellent question, Ben Abid. We've talked about it before. So WHO claims that the cure will be available by 2030. But at Actual Edge, like many medical doctors, like many PhD in biology research about vaccine bacteriologists, we can say that the vaccine or definite cure for HIV will probably be available from 3 to 6 years' time. The WHO will always give you a very late date because they want to cover their backs. They don't want to someone to hold it against them, Mr. Ben Abid. So we believe that the cure will be available from 3 to 6 years. But at Actual Edge, we believe in science. We believe in medicine. So, Mr. Ben Abid, if someone claims they have the cure for HIV with a flower or with a tea, please don't believe them. Only believe medical sources. Only believe the WHO. I hope that answered your question. When we expect a therapeutic vaccine? Well, as we just answered, Mr. Mithun, there's been a lot of advancements recently with many clinical trials being quite successful, proving that HIV disappeared in new vaccine trials with a lot of people. We also have 6 people that use different treatment to cure HIV. A vaccine will be available according to the WHO by 2030. Now, at Actual Edge, as always, we feel very optimistic and we feel like we can find a vaccine by before 2030, maybe 2026, 2027 sounds like a good year where it might be available. Now, Mr. Mithun Mondal, it's important to clarify that these are only our expectations. Please keep yourself informed, keep yourself coming to this channel. We are going to give you all the updates as soon as they are out. And don't stop believing in the power of medicine and the power of science. So we are here to help with whatever you guys need. If you have more questions, please paste them in the chat box and we will be very happy to help. Mr. Ayse, my partner, is responding you in Turkish. So you are also able to follow our live stream today. Well, as we were saying, guys, don't forget to continue to paste your questions. I'm just going to speak because I have other before we ended our session today. So we were that stigma doesn't only affect individuals, but entire communities. It creates barriers to accessing healthcare support systems and opportunities for education and employment, especially if you are from a developing country. Stigmatizing language and discriminatory practices perpetuate misinformation and fear surrounding HIV. So how can we fight against this stigma? First thing we wanted to mention, education. Education is key. By spreading accurate information about HIV transmission and treatment, we can dispel myths and challenge misconceptions. It's crucial to foster a culture of understanding and empathy. Next, promoting inclusivity and acceptance is vital. Everyone deserves respect, dignity, and support, irrespective of their HIV status. Creating a safe space and supporting communities encourages open conversations, reduces fear, and empowers those affected by HIV. Language matters too. Avoid stigmatizing and judgmental language when discussing HIV. Let's use respectful and inclusive language that emphasizes the person first, not the virus. Additionally, advocating for policies that protect the rights of individuals with HIV is essential. These policies ensure equal access to healthcare, education, and employment without any form of discrimination. By coming together, we can break down barriers, challenge stereotypes, and create a more compassionate and supportive environment for everyone affected by this horrible virus. So we have another question in the chat box. Benabid, vaccine is preventive, not curative, but the problem is the price of the treatment. Gene therapy is highly expensive, but the problem is that national security, PLWH, will stop taking ART if they... okay, Benabid, thank you very much for your comment, but we understand your concern about the price. We know that the price will be extremely high at the beginning when it's released because it's very likely to be produced in the United States. And I'm pretty sure they're going to charge a lot of money at the very beginning. So we want you to know that it's usually after 2 years that the medicine is released in the United States, that the patent, the copyright is expired. Therefore, your country will be able to create a similar medicine, not a similar medicine, the same medicine under a different name at a cheaper price. And I'm not sure if you wanted to say anything else because your message got cut off, but I understand the concern you're expressing. Now, affordability and accessibility of treatments, including gene therapy, are critical issues in healthcare. Regarding the cost of treatment, especially with gene therapy and antiretroviral therapy for people living with HIV, high costs can pose a very significant challenge, Mr. Ben Abid, and we are totally aware of this. Access to affordable and effective treatments is essential to ensure that individuals can manage their health conditions without financial barriers. So, Mr. Ben Abid, if you want to clarify what country you're writing from, we might be able to find a government program that will reduce the price or will give you some form of benefits so you can continue exploring new options for a HIV cure, Mr. Ben Abid. And ladies and gentlemen, we are getting close to our time of ending. If you have any other questions, now is your time to ask those final questions because we have to leave now. However, we will continue going live more regularly to assist you. For us, this is an absolute pleasure. Getting to meet the people who are on the actual edge, our subscribers. We tend to, we feel very sorry for what you're going through. We understand your concerns. We understand that it's very difficult for us to give you information on a daily basis with you constantly worrying on when you're going to get your HIV vaccine, on when you're going to be cured, on the challenges you're going through, on how hard it is for you and how little big corporations are doing for the victims. But from actual edge, we can assure you that we are consistently trying to find new information. We are consistently, persistently chasing new companies, new ARV medicine, new discoveries about antibodies, new forms of PrEP, new ways of doing gene editing. So the cure will be available for absolutely everyone, regardless of what part of the world you're in. Now, guys, thank you very much for joining us today. It's been an absolute pleasure answering your questions. I hope that you feel a little bit better, more optimistic. Remember, if you have any questions, we will be doing these live streams regularly. We will be informing you through the community post. Thank you very much for staying on the actual edge, and we'll see each other in next live stream. Bye, everybody.